We are reimagining access by putting access into the core of Novartis. That every single medicine that Novartis develops will have an access plan before we launch. I want nothing more than to create incredible innovations that change the practice of medicine, that reimagine medicine, but then get those medicines to the millions and millions of people around the world who need it.
We need to go to the bottom of the pyramid, and we need to go to the unreached. That means access is actually first reaching. If you can't reach out to the unreached, then you cannot provide access to anything.
We need to act as a catalyst, actually reaching out to distant communities. The opportunity we have is to create an ecosystem where we can work with people from technology companies or drone companies and actually bring that ecosystem together.
Our co-founders, they noticed a really serious last mile access issue across Africa. So I always tell people, figure out the problem that you're trying to solve and then come up with an innovative way to solve that problem.
We need to look very closely at what's happening in those countries where we aren't making the progress we should and what needs to happen. We need to stop thinking about malaria in its own and start thinking more transversally. And we look at the problems we've got and we look for solutions outside our own field, we can make progress.
I see really more of a interlacing of business models for the bottom of the pyramid people who cannot pay, although treating them as consumers then turns the model around whereby they can contribute through self-reporting of information. Then they become agents that can be extensions through digital technology and digital knowledge.
We see digital, that it has to become an integral part of every health system, as essential as hospital beds are for patients to get the better quality of care. I think AI will not replace doctors, it will only improve quality of care and make health providers make better decisions.
We're not going to address universal health coverage or the SDGs through just public sector finance. So we need to bring in private capital to support market-based solutions. And so I think the innovation is not about how much more money can we bring to bear in this space. It's how do we structure that management in a way that is linked to supporting the growth and performance and impact of these ventures. That's the challenge.
I think we would come a good step further if healthcare would not just be treated as a cost item, but as an investment opportunity and linked more clearly to economic growth, and also that care component as something which is really worthwhile investing in, also from a pharmaceuticals company. That would be a good way forward, I think.
Finally, a quotation from Einstein, imagination is more powerful than knowledge. That's why we must reimagine what's possible.
I think it's a real mark of leadership when you have companies, governments, NGOs who are willing to kind of open themselves up and say, we want feedback. We want to know where we're not doing as well as we could. I think that's what this event is about, and I think that's a powerful way to move forward.
I was very inspired by the vision that was communicated by Bas, and especially looking at how to connect social entrepreneurs in the big picture of how to address access hurdles. And really bring all the different sectors of the economy to solve these issues.
Governments are the main providers of healthcare in all the countries we are talking about. We need to work on that interface, we need to make it work, and then really I think we get a very exciting development.
How can we take this partnership to the next level to really deliver access to medicine for the people at the bottom of the pyramid?
I think the actual forum is fantastic because it's the open discussion that Novartis brings and brings all the stakeholders together in a way that they're sharing the information and the learning, which I've never seen before. It's a great learning opportunity for everybody.